Healthcare is all about behavioral change. Just because you develop diabetes doesn't mean you have to die with it.
Right.
And right, so diet and exercise can go a long way outside of taking the pill, right? So how do you, and it's hard. Trust me, it's hard. My father was a diabetic. I get it. And if you don't have someone to coach you outside of the doctor's office, it's very, very tough.
Welcome to 20-Minute Leaders. Just sit back, relax, and learn from the leaders of today. It's a journey. Each one is different, unique, inspiring. Let's get started. This episode is powered by J Ventures, a community-driven VC fund in Silicon Valley, in partnership with Lomitech, and sponsored by Homeward Ventures, Hippo Insurance, Upwest, Hillel at Stanford, Leap, and Birthright Excel. Welcome to 20-Minute Leaders. Today we are in the health tech space. Meet Tom Foley, Chief Growth Officer of GenieMD. Tom has over 30 years of experience in information technology. He has led many transformative initiatives in and out of healthcare. His strategic thinking and innovative approaches span across the risk-to-cloud continuum to affect the manner in which delivery of care is imagined globally. Foley also moderated the Health Innovation Think Tank, an executive collaborative made up of 50 healthcare delivery systems, payer organization, and healthcare IT vendor thought leaders who offer their insights, leading to the establishment of best practices on a variety of issues associated with value-based care, connected health, and virtual care. Tom Foley, welcome to 20-Minute Leaders. Thank you so much for joining me. How are you?
Awesome. Thank you very much for having me.
Thank you.
Looking forward to the conversation.
Thank you very, very much for being here. I'm excited to talk to you about GenieMD, or today the Chief Growth Officer, but you've been in the telemedicine space for a while and thinking about health tech, and especially during Corona, more than ever, it's evident that this is something that we need, and I'm excited to hear the founding story of GenieMD, but also about the different struggles and the different things that are happening around the world that made this a necessity. And so, Tom, maybe to get us started, tell me a little bit about your own career, your own life, and sort of the things that guide you in the decisions you make about what things you do.
Happy to do so. So, my career started long ago with UPS, actually. So, UPS, believe it or not, in the mid 80s, that's how long ago my career started. But in the mid 80s, when you called UPS to pick up a package, they hand wrote that information. And then they faxed it
Wow.
over to the package car center, as they called them, distribution centers, and it got to the vehicle that said, "Go pick up this package." I started out, so in '86 they started automating UPS. So my very first project was the lead systems programmer on how to automate the telephone call center. So
Wow.
instead of handwriting it, putting it in a computer. So we did some very innovative things in the fault tolerance space using PCs. Again, think about use of PCs in 1985, 86 versus what they
Wow.
do today. And then that led to, okay, I got a package. How do I, just like FedEx, at the time FedEx, the FedEx truck drove away and you knew that the package was delivered. So I got involved in wireless data at UPS, and then joined a wireless data company. Actually, we helped build one of the first national wireless data networks in the country.
Wow.
I left UPS and went to a company called RAM Mobile Data. And again, think about it, 1992 to 95, wireless data. What the heck is that?
Yes.
Right? Yeah, so think about the cell phone and what it was then. Again, a big brick. It was like a backpack you needed with long antennas, right? It wasn't the iPhone, that's for sure, and it wasn't an Android device either. But the point is that we built out one of the RAM Mobile Data built out one of the first national wireless data networks in the country. It's now all that frequency and things of that nature was sold off. Eventually, it ends up being in the hands of AT&T Wireless Data.
Very, very cool.
Yeah, and then from there, I got involved in a number of innovative scenarios. And in the early 2000s, I made a specific jump to healthcare. I was doing my own independent consulting for about 7 years. I can remember reading this article about how all this paper existed in healthcare, and that was a problem to be solved.
Yeah, to
Obviously,
say the least.
healthcare is always the last frontier to solve a problem, right? So I got involved in consulting with the Greater New York Hospital Association on transitions of care and things of that nature. Started up Thompson's eHealth media division here in the U.S. Just prior to that, and then I got involved in a number of different things as HITT Act took off. I got involved in a number of EHR vendors and helping them build out specific solution portfolios.
So tell me a little bit about the telehealth and health tech space from your perspective and your career trajectory, and sort of leading up to you joining GenieMD. Well, what's happening, and how did that all change when COVID broke out?
Yeah, it's a great question. So think about let's go back 10 years in the HITT Act, right? I talked about paper in healthcare. At the time, you when you walked into your doctor's office, your health information was on a paper wall, in a folder, in a couple papers, and you got to look through. There was never it was not online, and it was not really
Right,
accessible unless you physically had that folder in your hand. So high tech took that paper off the shelf, put it and computerized it, and now here we are at COVID. And what COVID did for, unfortunately, COVID did exist, but what COVID did with telehealth was let me back up. We would not have been as successful in treating patients during COVID, not necessarily in the emergency room, but in the ambulatory centers, because we would not have had access to the primary care
right,
office. Again, they were closed, right? So, high tech actually was a saving grace to some degree in having your information online.
right,
And then virtual care came along before COVID. Virtual care, telehealth was really a nice to have feature, and it really wasn't reimbursed well from the payer side of the equation. And so therefore, COVID went from a nice to have to a must have feature within the delivery of care model. And then what we learned was, hey, Mikey liked it, the doctors liked it, and the patients liked it,
right,
and ultimately it started to find its own way in the value in which it brings to the delivery of care model. So bringing now healthcare outside of the brick and mortar is now
right.
seen as very viable, and hence why, and if it wasn't for CMS at the time that changed their payment profile on what they would cover during COVID, it would not have had the success it did have. So, uh, hats off to the CMS team at the time for making that happen.
GenieMD, what is that?
GenieMD, the virtual care is out of the bottle relative to Genie.
Now I get it.
But but the point there being is, we provide a virtual care platform. We have two hats that we wear. On one side, we are integrated with the GenieMD Medical Group, so you can and they provide urgent care services online through a telehealth session. So if you go to geniemd.com and click on the link, you fill out your chief complaint, and then eventually you might see a doctor. That's one side of the equation. The flip side, and when I say might see a doctor, is that you don't necessarily have to have a visual
Right,
encounter with a patient, between a patient and a doctor, to get a prescription written, right? So doctor might say, "Hey, I understand your chief complaint. You got X, Y, and Z. I just sent a script over to your local pharmacy."
right,
So on the flip side of that equation, GenieMD provides a platform. So we might be in a virtual care session, right? Because it's video. But virtual care telehealth is much more than just video. So what GenieMD provides is a full unified portfolio, as I call it, that allows a patient and a provider to engage in many different modalities. Modalities meaning asynchronously, I can go onto my website, fill out a chief complaint, not ever see you, and then the doctor could respond in many different ways. He could respond saying, "Hey, I get it," as I just said, or "Hey, let's schedule a call, let's have a conversation," and then it escalates to something very new in the market is, and part of virtual care is remote patient monitoring, meaning you have a chronic condition. Let's just say you have diabetes.
Okay.
And so, as part of being diagnosed as being a person with diabetes, then we might provide you a glucose monitor. Might provide you maybe a blood pressure cuff, depending on the scenario, and then you get enrolled into these programs, and then we monitor you. So the issue is that in the classic model of delivery of care, let me just say the average Medicare patient, as an example, 5 chronic conditions, 5, and sees 9 different doctors in a given year, and they only have FaceTime with that doctor for 15 hours.
Right.
Right. So the question that we try to answer, and we leverage remote patient monitoring, is what happens the other 8,745 hours?
Right.
That's really where, if and, there's a big issue in healthcare where you've gone through the trouble of scheduling for the doctor's visit. You got your diagnosis, you got your prescription, but I never went to the pharmacy to get it filled. Right. So the care plan and the behavioral change necessary once you get a diagnosis is very critical. Well, that all takes place in that 8,745 hours, right? When you're at and what not in front of the doctor, right? So remote patient monitoring allows you to have a device in your home. You take a measure 16 unique days out of a given month, and then we monitor that data. So if we see that your glucose level is out of whack, then we can engage you immediately, if you will, and coach you relative to what you need to do to
Right.
maintain a proper glucose level, right? So that's one of many different scenarios where remote patient monitoring, and on top of that, another feature set within virtual care, chronic care management, is able to now provide a 24/7 care model, but still leverage your provider and still see them these 15 hours, as I've said. We just provide now coaching and monitoring services in those other, like I said, that 8,745 hours. So now the delivery of care model suddenly changes, right, relative to hopefully better outcomes, which is the intent. Less emergency room visits because you're not managing your chronic condition properly, and potentially even less remittance. So we're lowering the cost of care while increasing the quality of care.
Right. That makes a lot of sense. Now, as chief growth officer, you're obviously tasked with the challenge of growth, and we can all agree that this is an important problem, and the solution may be fantastic. But how do you actually position yourself to grow? Especially at a time when this is great momentum because everybody's thinking about it, everybody's aware of it. What is sort of your strategic thinking around this?
Well, COVID was good and bad for the market, right? It was good because it highlighted the value of telehealth, and it valued that there are different ways of delivering care outside of the brick and mortar, and we're still waiting on Congress to make all the changes they made during COVID permanent, so that because nothing happens in healthcare unless it's funded, right? There's no, they're not. It's not a charity case in the context of everything is for free. But so the point there being is, if there's no funding mechanism, reimbursement mechanism, the providers are less likely to engage in that practice. So what we're doing is now defining what is virtual care, because as I've said earlier, it's beyond telehealth. It's beyond video. And so that whole continuum of a virtual care encounter, inclusive of remote patient monitoring, chronic care management, and there's a new category that CMS, Medicare, Medicaid is launching in 22 relative to the remote therapeutic monitoring, meaning remote patient monitoring says you have to have a medical device to report your data. Therapeutic monitoring, amongst other things, says I can handwrite or I can type in my vitals, right, or other social economic influences relative to the delivery of care. So think about it: telehealth, remote patient monitoring, chronic care management, remote therapeutic monitoring changes the whole dynamic. So we're trying to define that that instance of virtual care, and it's all about the differentiation. Our differentiation is we support that continuum, and it's not about only technology, but it's about the programs and the services that sit on top of the technology that ultimately allows a provider who doesn't have time anyway because they're seeing 25 patients a day,
Right.
and
Right.
they got their heads down in their EHR. How do they now monitor those patients and engage those patients? GenieMD helps solve that problem.
Do you find that there's any consumer behavior that needs to be explained or shifted in order to make this a proper growth? Is that a part of the strategy that you're thinking?
It is a huge part of the strategy, and that's ultimately the role of the coach. Because again, there's too many statistics and too many studies about what happens after you leave the doctor's office. Either you forget what the doctor said, no one wrote it down, or you just don't go fill that script, as
Right.
I said earlier. And healthcare is all about behavioral change. Just because you develop diabetes doesn't mean you have to die with it.
Right.
And right, so diet and exercise can go a long way outside of taking the pill, right? So how do you and it's hard. Trust me, it's hard. My father was a diabetic. I get it. And if you don't have someone to coach you outside of the doctor's office, it's very, very tough to achieve your goals if you're not willing to, if you don't have one encouraging you on changing your behaviors to achieve, to, as I say, to move along that awareness to wellness continuum. The awareness is your doctor just diagnosed you with diabetes. The wellness is I've got it under control, and I've maybe even gotten rid of it.
Right.
But what do you do in the middle, right? Behavioral change is the middle, and that's how you progress towards a better state of health.
I love it. Take me back a little bit to your journey. So you start off in your program, you're an engineer. You move to networking and wireless communication, transition then to telehealth, a bunch of different things. You're obviously extremely curious and lots of things fascinate you. But take me back to your childhood. What really fascinated
Oh,
you as a child? What really sparked your curiosity as a kid?
oh man, that's a tough one. I was one of six,
Okay.
and we lived in a small house, 3-bedroom house with 8 people and one bathroom.
Wow.
And we weren't the wealthiest family on the block, good or bad. One would say good only because it was uh, an eye opener relative to different ways of maybe doing it and
Right.
not getting stuck in the fold of thinking there's no way out, right? And but there's always a way out. You just have to have a plan, and you have to be diligent about it. So I was always on the innovative front, thinking a bit differently. My mom always said that I ran to a different drum, uh, and uh, I just was very diligent. I didn't take no as an answer. I was very persistent, and I might have done things the hard way, but it was I had a dream, if you will, that there was a better side of life.
Wow.
So that's a little bit about my background.
And you obviously need a lot of inspiration to have gone through the career that you've gone through. Where do you gather your inspiration today? What is something or some things that inspire you today?
It's just healthcare is just it's the two ends of a spectrum, right? You have the bad side of healthcare because there's a system out there that might not be working as best as it could, but then there's so much opportunity for not to be in a system that focuses on pain, right? I don't sometimes call it a pain management system because healthcare, if it doesn't hurt, you ain't going to the doctor, right? It's just it's when you
Right.
have pain, you go to the doctor and you're trying to figure out how do I get rid of it, right? Diabetes doesn't hurt, right? And you might not even know you have. But I will tell you a story real quick. Diabetes, and my father had, like I said, had it. Last 5 years, one leg amputated, second leg amputated, a third, an arm amputated, and a couple fingers. Right. So it hurts in the end. It's just a matter of when you're willing to accept that you need to change your
Wow.
behaviors and find out your consequences. So the ability to change a delivery of care model where you can be treated in the home and still maximize the ability to achieve wellness and encourage people to think about diet and exercise and how it can change them first, but how it can change their family, how it can change their neighborhood, and how it can change, frankly, the world. And because a healthier world is healthy for everybody.
Amazing. And what are 2 or 3 words that you would use to describe yourself?
Persistent is the first word.
Yeah.
The second word might be persistent. I won't go as far to say the third word is persistent, but focus, focus, persistency, and knowledgeable. You got to do your homework,
Tom,
and
thank
you got
you.
to
Yeah. Do
go
your
for it.
homework 100%, and I can definitely say that like an incredible journey, incredible career, and just very very inspiring work. And I want to wish you best of luck with GenieMD, and thank you for improving the lives of so many people around you, and thank you for inspiring me in these 20 minutes. I really appreciate your time and this conversation. And stay safe and stay healthy, and best of luck with GenieMD.
Thanks for having me, and
Of course.
same to you as well.
Thank you very very
All the
much.
best.